All right, hey everyone. It's Eric Martins here. After my last video, I said that I would make a video to discuss the differences between what's it like to get a CT scan versus a PET scan versus an MRI. So, a CT scan is a computerized tomography scan, and so that's basically the scan that I first received the for my initial diagnosis and finding of the tumor after they had found it on ultrasound. So the CT scan, most people have kind of seen the machine. It looks like a big donut, and basically there's kind of two different versions that they can do. Is they can do with contrast or without contrast, and that's where they put an IV in, and they put a contrast fluid into your veins, and that helps things show up on the CT. So basically, the CT is really pretty easy, goes pretty quick. So I've done both. I just had one again last week. So the first CT scan that I had was with contrast, and basically, like I said, they installed the IV. They put for my scan, it was kind of the pelvic area all the way up to the chest. So they had me put my arms up above my head. You lay flat on the machine, and they adjust you in there. And it's really very quick, and it's very quiet. It takes probably 5 to 10 minutes. They run you through the machine a couple times, and as the machine takes the pictures, and then once they finish, then they go and they inject you with the contrast. The contrast is probably the worst part of the procedure. It's pretty simple, but basically they push it very quickly in, and I would say you feel a coldness, or at least I felt a coldness in my arms, and then you can kind of feel the liquid contrast going through your body all the way, almost kind of down through your groin, and it really almost kind of feels like you're wetting your pants. And so you kind of feel this coldness, and then it kind of transitions to a warmness and almost like a wet feeling as they push it in. And then they basically they run you through again. The table that you're laying on kind of pushes back and forth through the machine as it does the pictures, and it's really very easy and very simple. The one I had last week was without contrast, which is basically the same thing. And it's very quick. I was in and out of the machine, done in about 10 minutes. So the CT scan, probably the easiest scan, my favorite of any, if you could call it that. The next scan, which is you hear a lot when they're discussing cancer, is the PET scan, which stands for positron emission tomography scan. And so that one's a little different in that they inject you with a radioactive glucose substance that's similar to the CT as far as like the contrast. And basically, from my understanding of it, and again, I'm not a doctor, is that the radioactive particles and the glucose attach themselves to cells, and specifically the cancer cells, and what they're looking for would light up when they look at the PET scan imaging. And so for my PET scan, that I had, basically, you go in. The first thing they do is again, right? They hook you up to an IV, and they take a little bit of blood so that they can do a glucose test. So they need to make sure, because they're going to be injecting you with a glucose, that that your levels are okay. So then they bring out the vial, and it's actually kind of scary, because it's like they brought out the vial of the radioactive glucose tracer, and basically it was in like a silver kind of like little like lock box, look kind of like a cigar box. They unlocked that, open it up, and then there was this big like metal vial in there that's, I'd say, a little bit bigger than a roll of quarters around. And they take that out, and basically the IV has 2 injection ports, and so they hook that into one, and then in the other one they have a syringe, which is basically a saline. And so they kind of alternate pushing the radioactive, the glucose tracer and the saline, kind of alternating pushing that in, so you get your dose of that. And then at that point they put you in a dark room. I was having a head to toe, right? So they want to minimize the brain activity, right? So you can't look at, you can't read, you can't look at your phone or anything like that. They basically put me in a dark room, had me lay down, threw a warm blanket on top of me, and you sit there for about an hour, kind of lay there for about an hour, just resting, relaxing, fall asleep if you can take a nap, until the tracer has time to spread throughout your body. And then very similar to the way that the CT machine kind of works. You go in, again, looks like a big donut, kind of a bigger donut than the CT. And, they lay you down on the table, they get you situated on there as it kind of adjusts itself. And I would say it's very similar to the CT, except it's extremely slow, much slower. And so for a head to toe PET, it basically kind of started at, they kind of run you through once. And I think that's kind of where the machine is kind of trying to figure out where your body is and in adjustment to things and how it needs to take the pictures. And then once they kind of get all those measurements right, then you can hear the spinning, but it's not loud, it's not uncomfortable. You don't have to put earplugs in or anything like that. You just have to lay very, very still, and it kind of incrementally moves down. Takes pictures for a certain amount of time, then moves down, then takes some more, then moves down, takes some more. So the most challenging thing with a PET scan is basically just laying still and holding your position for roughly 45 minutes. I think it's about 45 to 50 minutes total that you're in the machine. And so I wouldn't say it's uncomfortable. They throw a warm blanket on you. And the good thing is you've already had the tracer, so there's no kind of injections or anything like that. You can have your arms in a comfortable position while it's going on. So again, PET scan, pretty simple, and other than the length of time, so not something that I really minded too much, which is good because I'm going to be getting one about every 3 months as I go through chemo, and then it'll continue on. I'll be getting them pretty frequently over the next 5 years or so. So on to the next one, which is the MRI, which is the magnetic resonance imaging scans. So MRIs, I'm just going to say up front, I hated getting MRIs. So I had 2 different MRIs to this point. So one, I had a liver MRI, and I had a spinal MRI. So for both of them, I would say it's pretty similar, other than the positioning of the body. So for the liver MRI, I had to hold my hands up above my head, right? And again, for this one, it was with a contrast. So, you're hooked up to an IV, and they push it through, during the procedure. So it's a little bit, uncomfortable with that. They do pictures with the contrast and without. So basically the way the tech explained it to me is, hey, once we push the contrast, we have 20 minutes to capture images. So they did about 25 minutes of images without the contrast, and then about another 20 minutes or so of images with the contrast. So again, it was about 45 minutes for the liver MRI one. That one you lay on I was laying on my back. And this is kind of what people I think are more familiar with. You see in the movies and stuff like that, or on the doctor shows where you're in the very tight tube, the confines. There's a lot of questions you got to answer, like, do you have anything metallic in your body, and things like that, just to make sure, because it's very strong, powerful magnets. So on the liver MRI, what made it really uncomfortable on that one was that you have, because of how the images that needed to be taken, they could only be taken primarily when my breath was held. So a lot of commands as far as holding your breath. So it'd be, hold your breath for 20 seconds, images are going on, then breathe normally for 20, 30 seconds, hold your breath again for 20 seconds. And that goes on and on for the entire 45 minutes. So it gets pretty uncomfortable because you're never really getting kind of like a full chance to kind of recover, and you're holding your breath. And so you can't really ever just kind of get in the zone, because you have to be listening to make sure you're doing the commands properly and doing the breathing properly, because sometimes you need to be breathing in and holding your breath, and sometimes you need to be maybe breathing out during imaging. So the other thing that kind of surprised me about the MRI that's really very uncomfortable is the noise. So it's extremely, extremely loud. So you have to put earplugs in. The way I described it was it feels like you're trapped inside maybe like an EDM mosh pit or something like that. It's just like strange noises, and you can kind of like, make up like beats in your head or something like that, but they're extremely loud and strange as it's doing its thing. So the other thing is, during the other MRI I had was the spinal MRI. On that one, I had to lay. It was still on my back, but I didn't have like anything like laying across my belly like I did in the liver one. And with that one, again, you have to lay very still the entire time. The only thing that was better about that one was that I didn't have to hold my breath. So that one, they were like, hey, if you can, just relax. If you can, take a nap. I don't see how anybody could possibly take a nap in there because of the noise. And the other thing is so the machine didn't really have a chance to, I think, really heat up during the liver one, because the time frame of the pictures was only about 20 to 30 seconds as you're holding your breath. During the spinal MRI, they were doing like 3 minutes to 4 minute sessions straight of pictures. And so the noise is very loud for that entire time, and it got extremely hot in there. So about halfway through, when they had to come in and do the contrast, I actually asked them like, hey, can you please take the blanket off? Can you turn up the AC? Because it was to an uncomfortable point of how hot it was inside the machine. So the MRI is just extremely loud and extremely hot, and I said uncomfortable in general. So if I never had to do another MRI again, I would be happy. So that's kind of the difference. I mean, it is what it is. You just kind of deal with them. I'm definitely going to get used to them, but I would say, kind of in order, CT, the best, easiest, quickest, PET scan, not too bad, just kind of uncomfortable with, how long you have to stay still, and, MRI, the worst, extremely uncomfortable. I'm not claustrophobic, but you do kind of get, annoyed of being in the tube for so long, and just noise. The noise is what I think really bothered me. Oh, and I guess one other thing, as well, that I noticed is when they were doing the really long pictures, like the magnetic, like poles are, shifting back and forth. And so actually, like, I could feel it like almost vibrating like inside my body, like, and my muscles, like in my legs and stuff like that, started actually like twitching, like frequent twitching. And I kind of had some pain in my arm when they were doing up in that area, like twitching as well. And I'd asked the tech about it, and he said, yeah, that's pretty normal. A lot of people feel that within their body. So so that's kind of those three. I've also had an echocardiogram recently as well, which is kind of like an ultrasound of the heart. That was actually a little bit more uncomfortable than I expect. It's kind of an uncomfortable position your body has to be in. And then as well for that one, there's a lot of, the gel, they put the gel on like you see with a typical ultrasound, and kind of, they have to do all different photo areas of your heart. And, there's a lot of holding your breath, releasing your breath with that one. And then it was actually kind of painful when they did, when they lay you on your back, and they have to kind of do the underneath of the heart. And she actually put the kind of the wand up here under my sternum, and she had to kind of like dig in and push up to go like below the rib cage and to look at the underside of the heart. And maybe my tech was just kind of mean or something, but she was pushing really hard, and that was kind of painful. So anyways, so that's kind of the different scans. You can find obviously a lot more on Google if you want to know like the science behind them, and how they all work specifically and stuff. But I just kind of wanted to give an update on what it felt like to get one. So anybody that's getting one, that's kind of hopefully that kind of answered your questions. And if you have kind of any other questions about the scans and what it's like to get one and what to expect, because there's some fasting and other things like that involved, just hit me up in the comments. All right, thanks.